Welcome to Metabolic Health with Dr. Lindsay Ogle. Today, I am joined by fellow board certified family medicine and obesity medicine physician, Dr. Shayla Toombs-Withers. And she also just passed her certification for or through the Institute of Functional Medicine. So super exciting there. She is continuing to learn how to better treat her patients. I'm so excited to learn from her today about plant-based nutrition. She has practiced plant-based diet for several years now, and she takes her experience and her knowledge to help her patients treat and prevent chronic conditions. She has a practice called Essence of Health Wellness Clinic and Coaching based in Chattanooga, Tennessee. And she helps individuals improve their health using her signature mind body balance approach. Her basis for health are in line with two of her favorite quotes: an ounce of prevention is worth a pound of cure, and let food be thy medicine. Welcome, Dr. Shayla.
Thank you, Dr. Lindsay. I'm excited to be on your show.
Yeah, thank you so much. Well, let's just get started. What makes plant-based eating particularly effective for metabolic health compared to other dietary approaches?
Yeah. And first I'm glad you're even, addressing this topic because I feel like it's still something that a lot of us, especially in healthcare, don't talk about enough in terms of plant forward way of nutrition. And so so when it comes to metabolic health, what makes plant-based nutrition a good solution for a lot of folks in this area is because it's easily sustainable for most people because you get full. You're able to eat more food. A lot of times I'll see, folks who say, well, I don't eat much, but I keep gaining weight. Well, with the plant-based diet, you are able to have more calorically dense type of food. So you're able to eat more and feel fuller for a longer period of time. Plants have more fiber than a lot of other foods do. So you're able to feel much more full and satiated, which then in turn can prevent you from reaching for those snacks and reaching for other things that may be less healthful for you. In addition to that, metabolically, what can happen when we eat more plants is that it also helps to stabilize our blood sugar because of that fiber and that slow release process that's going on. It takes your body longer to break down those really, complex carbohydrates that you're getting through plant-based foods. And so by taking your body longer to break that down, and that actually stabilizes things that are going on with your blood sugar, which in turn helps your body from producing more insulin and fat related to that. And so it's very helpful for those folks who maybe need to get back on track with their metabolic health as well.
Yeah, that's awesome. And I like to talk to my patients even about like food sequencing and having the fiber and the vegetables first in the meal. Because, like you mentioned, that can help with both fullness, so it can help with portion control. Because then towards the end of the meal, you'll be too full to eat more of those, maybe the starches or some of the other foods that we're trying to limit. So it's much easier to cut back on those. And like you mentioned, it helps stabilize blood sugar during and after the meal. So that's a tip that I like to share as well if someone doesn't want to go, fully plant-based, but to at least have those first.
Right, and for sure. And I often tell people as well, because a lot of times people will be like, you will join my practice and say, well, do I have to be vegan? And I'm like, no, that is not, my goal is not to make the world vegan. That's just not a thing. But we all can afford, to put more plants on our plate because of these many health benefits. And whether that look like, you having a large dark green salad and then maybe putting some of your salmon or your chicken or whatever over the top of it, then that's going to be much more helpful for you to eat that than the cheeseburger alternative, for example. So really, it's just like getting more plants to your plate that way.
Yeah, yeah. And that makes me think of like a common misconception about plant-based diets is that you have to be vegan or vegetarian. And like you said, that's not necessarily the case. Do you find that, some of your patients or clients feel like it's going plant-based is a little bit intimidating or difficult, or how do you approach that transition for somebody?
Yeah, yeah. So initially it can be a challenge because it's a lot of it is mindset. So that kind of brings back to that mind body balance approach too that I talk a lot about. But a lot of it is mindset and changing your mind as to what your plate should look like. So for so long, for many of us, we grew up in the kind of the meat and two sides kind of plate, and and that's kind of what you're used to seeing. And so for the vegetable, it's just this little bitty side. And so if you're telling somebody, well, I want you to eat, just mostly vegetables, they're thinking still that meat and two sides, and that looks like a really tiny, and they're like, what? I'm supposed to get full, by doing that. And so a lot of it is kind of rewiring and rethinking that thought process, because you can actually get full off of these plants, and then you don't need as much of the other things. And then the other part to it is this misconception, even when it comes to protein. A lot of people feel like, well, plants just aren't very nourishing. If I just eat a lot of plant foods, then I'm gonna be hungry, I'm gonna be malnourished. They think probably of the 70s of the vegans who were hugging the trees and they were these skinny little things. Well, that's not, true. We know a lot more about nutrition now, and you can actually get, a good variety of nutrients into your body when doing this healthfully. So what does that look like? For instance, you want fiber foods, you do want the dark leafy greens, but then you want color. Really. So when you get color, I usually explain it to people as first, look for rainbows of colors because that's going to make sure that you're getting a lot of different vitamins and nutrients. Our fruits and our plants, they actually have those pigments because those are the antioxidants as well, and the phytochemicals, things that help do those really good things in our immune system and our gut health and our metabolic health. And so you want all those different colors. And so when you see that, you know that you're getting vitamins and nutrients. And then when you get foods like your beans or your tofu or your tempeh, even oatmeal, those things have protein in them. And so you still will get protein from those foods as well. And then you will still get, your fiber. They're high in fiber. They help to balance the gut, help to balance the blood sugar. So you are getting a lot of different nutrients. But just for a lot of people overcoming that initial hump of the mental part of it that, oh, she's telling me to go eat this. You're thinking that little side of baby carrots you probably had when you grew up. And that's not what it is. It's so much more that you can have now.
Yeah, and I think that highlights the importance of working with a trained medical professional, whether that's an obesity medicine or lifestyle medicine physician or a dietitian or a coach or both, or, all, creating that team around you to support you in your health journey because it is a process and it's not something that we just like flip a switch and everything's changed and perfect the next day. It's really like a stepwise approach to optimizing our health. And I'm sure you see that in your practice all the time.
Yeah, yeah, for sure. It's definitely that stepwise thing. And that's the other thing too, sometimes we can get in this perfectionist mindset where it's got to be all or nothing. And that's not the case either. Even if it just starts, usually for people who may be really hesitant, I'll usually just have them just start with one meal. We take it one meal at a time. And if that looks like, maybe your breakfast is usually bacon and eggs, well, maybe let's add a little spinach into your eggs, scramble a little spinach in there. What's that feel like it tastes like for you, And we can take it step by step until then it's not even that mental hump there anymore. It becomes the norm.
Well, yeah, I love that approach. One meal at a time, or even, yeah, one ingredient at a time.
Right.
It's wonderful. And I love the, trying to avoid the perfectionistic mindsets that so many of us have kind of as our baseline. But I guess along those lines, w what sorts of pitfalls do you think pe or do you see people fall into when they're moving towards a plant-based diet? And what are your strategies as an expert to help overcome those?
Yeah, yeah. So one of the huge pitfalls I see, especially in the metabolic health world, when people go plant-based, and I see this a lot of people just kind of, watch one of the documentaries and say, "Hey, I decided I need to go plant-based, so this is what I'm gonna do." is the carbs. And a lot of
Mhm.
times folks will just focus on the carbs and they'll say, well, hey, I'm eating mac and cheese all the time. It's plant-based, there's no meat there. But that's not also healthy for you to eat that all the time as well. And so that's really one of the biggest pitfalls is that a lot of people, I feel like will still kind of have that mentality of I need to get full. So what's going to get me full is going to be the mac and cheese or the potatoes or the large amount of rice or bread. Hey, I'm not eating a turkey sandwich. I'm just, eating a cheese sandwich or whatever, but just a lot of processed carbohydrates. And so I have seen that even, because I tend to see a lot of folks who may have tried plant-based before or who are even plant-based but are still needing to optimize their health. And so that's a big trend that I see a lot of times is they'll kind of fall back on those more processed carbs just to get full, but not putting that thought into the other less processed foods that can still get you there because a lot of people think more too in terms of like a volume perspective.
Mhm.
People say, well, I just ate this sandwich. So the sandwich was really small. So it doesn't seem like, it would be a lot versus you could have had a bowl of oatmeal, which would have got you much more full, likely less calories that's in that sandwich, and gave you a lot of variety of vitamins as well, help stabilize your blood sugar better, help you lose weight better. So a lot of it is kind of reprogramming some of those things too to avoid those types of pitfalls. Um, Another pitfall I see when folks try plant-based is that they struggle when they're like traveling or when they're on the go, when we're at home. And that's with kind of almost any diet that we partake in. When we're at home, it's kind of easy. You're in your own environment, you're able to be in control of what you cook or what you prepare. But then when you leave home, that can become a bit more challenging. So a lot of what I help folks with is planning for that. There are even restaurants, they may not be labeled vegan, they may not be labeled plant-based, but one tactic I like to share with people is even I do it myself when I go into a restaurant, if I'm out with family and friends, the first thing I do is look at that menu and it may not have anything highlighted that says vegan or anything like that. But what I'm looking for is what the plant foods are. So it may say, steak and sweet potato or, add broccoli to your chicken fettuccine kind of thing. But for me, that triggers, hey, they've got some sweet potatoes here. They've got some broccoli here. And so that way I know. So it may not be anything on that menu that screams vegan, but then I'm able to know, hey, you've got these vegetables in the back and you can put them all on a plate for me and I can order it that way. So, it just comes to that preparation and with just continuing to do it and feel more comfortable in what you're doing. And a lot of that comfort too comes from because you feel better. When we eat better, we feel better, we look better, we get more confident, and then we're able to continue to make these choices.
Yeah, well, thank you so much for sharing that. And I'm a huge fan of planning ahead of time. So I'm glad that you brought that up. That can be so powerful and take a lot of pressure off in the moment when you're, faced with that decision and looking at the menu. And I also like that you brought up kind of advocating for yourself and your nutrition when you're out at a restaurant and asking for what is best for you, even if it's not like explicitly on the menu, you can still ask for, those items to be put together for you. And I'm sure that, you've been able to be successful with that at the restaurants that you've gone to when you've asked for it. So,
Yeah, I have. Yeah. And especially, I've been to places where, sometimes there's like some fancy places where they may have a chef and there's like really nothing on the menu. And I've asked the wait staff, say, hey, I'm vegan and can you, what can you do? And they'll go talk to the chef. And believe it or not, at the times where this has happened, the chef will usually come out and say, and was excited to have created this thing that was unique and different. And they say, well, how did you like that? This was unusual. I created something new. And they actually enjoyed the challenge. I've never had one where they were like mad at me, for requesting something like that. So, yeah.
yeah, well, that's great. That's great because I'm sure, there's some people who would be nervous to ask for that. So I'm glad that you've had wonderful experiences and very positive ones. And I can imagine, yeah, as a chef, that would be very exciting to make something new off the menu.
Right. Something different. Yeah. Yeah.
Yeah. And while you were talking, I was also thinking about, the importance of language and how I really do like the term like, a plant-based diet or a plant-forward diet, plant-focused diet, however you want to necessarily term it. But I think that that's so much more helpful than maybe even like the vegetarian or vegan because like you mentioned earlier, you can be vegetarian or vegan and not be consuming the most nutritious foods. But when we're talking about a plant-based diet, we're making sure that we're getting those plants in, and that's our focus of our nutrition. And I'd just love to hear why those plants are so important. You had mentioned the fiber and the phytonutrients before, but I'd love to just hear a little bit more about why those plants are so important for us.
Yeah, yeah, and I'm glad you touched on those label differences too, because I do. I try to get away from that when we're talking about health, because if we kind of go back to what veganism even is, it's not even so much the health part. It's more of a lifestyle. People are choosing to avoid all animal products for a variety of reasons, whether it's ethical, environmental, and so it's so much more than just because I'm, going to lower my cholesterol or lose weight kind of thing. And to that extent, then, which is why I have also seen people who are vegan, under this whole ethical lifestyle thing, but who may not have optimized their health because of that approach, because it really wasn't about the health benefit anyway. And that's when a lot of those other kind of food and dietary pitfalls and things that we discuss may come into place. Now, going back to kind of those benefits when it comes to our metabolic health, there are a lot of other benefits. And so, a lot of things, one that can come into play is even when it comes to our caloric intake. We know that when we're trying to lose weight or get to a more healthful weight, that we may need to offset the amount of calories that we're intaking for our metabolism for that balance out. And the thing about plant foods is that if we're sticking to the unprocessed plant foods, is that they're very low in calories. And so I like to use the example of spinach. I myself will buy one of those family tubs of spinach just for me, but you cook that down and it is just not very much, at all. But it's so low in calories. And so you really don't even have to like put it in your food tracker or anything if it's just the spinach. And you can really, fill up on that and not have to worry so much about that caloric intake and offsetting your metabolism in a negative way when it comes to plant foods. So that's another benefit by adding more of those whole unprocessed plant foods to your diet. The other thing is when it comes to fruit. Um, a lot of times, especially nowadays, we're using GLP-1s in practice for metabolic health, and some of the GLP-1s, constipation is a risk with those medications. Well, fruit is a good thing that can help to prevent that because of the fiber in it. But it's the certain kinds of fruit. So it's the ones you want with the skin on it. So those apples, those pears, those blueberries, blackberries, those things where you eat the skin, which in turn is also giving you that fiber benefit, balancing your blood sugar, preventing the constipation if you're on that GLP-1. For you keeping your bowels regulated, also giving you that gut health benefit. We know a lot now about gut-brain interaction and our gut health being so important for a number of health conditions, reducing mental health disease, reducing cognitive decline, reducing risk of colon cancer. So many health benefits come into that when we're balancing our gut health. And then the other part of being able to eat those fruits is it prevents you from making those less healthful choices where you may want to go grab for the Oreos or the ice cream down the road. You can, because that fruit can satiate your sweet tooth there as well in a healthful manner. And so, you get all those benefits. So you get the lower calories, you get more full, and then you're still able to get those benefits for when you may want something sweet by having like fruit or other plants that way.
Yeah, that sounds great. You're making me want to go to the store and just fill my basket up with fruits and vegetables.
Yeah.
But I'm curious because for some people, like we said, this may be a little bit intimidating to talk about. What are your tips or strategies for having a plant-based diet be, I guess, sustainable and long-lasting? We talked about some challenges, but any specifics about helping this to be truly a lifestyle that's going to last long term?
Yeah, yeah. So a couple of things. One is really finding things that you like. So, if you know flat out you don't like broccoli, then starting with broccoli is not going to be the best choice. So finding what you like. Usually I'll ask, folks that I'm working with, kind of what are your favorite foods? And if it's tacos, for instance. Okay, well, what do you usually put in your taco? They name all those ingredients. And then, okay, well, how can we make this taco maybe a bit more healthful for you? So maybe, instead of maybe the canned salsa that may have added sugar and things for it, maybe we can chop some tomatoes and onions and put it in there. Easy fix. Maybe we can add some black beans to it to give you a bit more protein and fiber there, without doing a lot of more, fat heavy types of additives into that taco for you. Also, so that's an easy fix. So we start with kind of things that you already like, and then that becomes less intimidating, to do it that way. Another tip there is to really focus on the how you feel about it. And I'm a big fan of journaling. I don't know if you do journaling or not, but I'm a big fan of that. So I'll usually have people, at least for a little while, kind of, hey, you've eaten this way for a week. Write down for me, how do you feel? Do you feel anything different? And then sometimes, usually what I'll get is, hey, maybe I did sleep a little bit better, or I did feel a little bit more energized to, do my walk for the in the evenings, or and so then just having that written down. So then where it really comes in handy is the next time it gets hard, because life gets hard. Life is life. Then you have that to refer back to. Hey, I remember when I was doing such and such, I was feeling really good. Let me go back to that again because that made me feel really well. And so that's another way that makes this more sustainable, for people. And then the other side is really just tracking those health goals and those health benefits. I'm a big fan too of creating goals and goal setting, and making those goals, tangible and realistic. And so then when we are able to achieve those goals, we tend to want to continue doing that thing that helped us to get there. I love it when patients send me a message, hey, I'm running my first 5K, or I had a lady who's running her first like half marathon, and she had never been a runner. And it's amazing, to see people just accomplishing those things because they're feeling so much better. We're able to take them off of the blood pressure medications, cholesterol medications, because their metabolic factors, their biometrics, all of those things have improved as well. And so that's really, what makes this more a sustainable approach, because they don't see it just as, oh, this is just this diet that's just going to help me lose 20 pounds. But, oh, this thing, I feel good. I'm running marathons. I don't need cholesterol medicine. It's so much bigger than that.
Yeah. Wow, that's amazing. And I think you're kind of describing it, but I think it's really important to highlight that when you are noticing those improvements, to celebrate those victories. And I'm sure you do that all the time with your patients. And my experience when I'm seeing patients and they're achieving these health goals, sometimes they do it and maybe are like still so focused on future goals that we're not really clocking all of that they've accomplished already. And so when, I see them for a follow-up, I'll say, "Hey, like X, Y, and Z is better than we talked before." And just bringing that up, and it can be so easy to overlook that because usually our minds were focused on that next goal ahead. But it's so important to celebrate along the way because like you said, setting those goals, celebrating them, it's going to continue that momentum moving forward. And it makes it so fun to continue because, every almost every visit you're celebrating something, whether it's a weight goal or a health goal, like you're able to get off your blood pressure medicine or your A1C is improved, or those non-scale victories, like how you're feeling or some activity that you're doing that you never did before. I think it's so important to track that over time, like you mentioned.
Yeah, yeah, for sure. Yeah. And the thing about it is, I don't even know if patients realize that, but you and I as the physicians, we're just as excited as they
Yeah.
are. So yeah, so patients, if you're listening, tell us more. We love it.
Yeah.
Yeah.
Oh my gosh, I love to hear it. Yes, I totally agree. Yeah. So, any other thoughts that you have about plant-based diets? Any last recommendations or any thoughts you'd like to share with the audience?
Yeah, yeah, sure. And so I do have a free 5-day program. It's called Nourish and Flourish. And what it is it's really just getting people started with that approach to prioritizing their health and optimizing their health. And so there are some plant-based recipes that are included in it, as well as health tips every day over the 5 days. And so it's free. It can be found at drshayla.com/NF challenge. And Dr. Lindsay will have the link to that as well. And so really, because the resounding theme that I hope that, folks have gathered is that don't think of it as an all or none or that it's, an intimidating thing, but that it can just be incorporated just for your overall healthy lifestyle there.
Yeah, absolutely. I'll definitely include that link. What about if somebody wants to, learn more about you? Do you have social media? I know you have had a podcast before. Or how can they find those?
Yeah, so my podcast is the Essence of Health Tea Time podcast. It is not about tea, I should add. It is about spilling the tea on all things plant-based nutrition, health, and wellness. And so it's on all of the podcast platforms, Apple, Spotify, and more. My website is essenceofhealthwellnessclinic.com, where you can learn about my practice. I do have a brick and mortar practice here in Chattanooga, Tennessee, but I also offer virtual care in over 35 states. And so I'd be happy to chat with you. You can schedule a free consultation right from the website. And then you can catch me on social media at Essence of Health Wellness Clinic or at Dr. Shayla on most platforms.
Um, that's amazing. Well, thank you so much for taking the time to share your expertise. I really appreciate it. I think it was inspiring to, like I said, myself and all of our listeners. I just really appreciate, having you here today. So thank you so much.
Thank you for having me, Dr. Lindsay. This is great.